Ideal hair loss treatment has to be comprehensive in approach. A dermatologist is actually best suited to offer this kind of treatment. Initially, it requires a very detailed assessment, both of history and the actual clinical examination of the scalp and the hair to determine what is the exact cause and extent of hair loss. Very often, we may need to do some laboratory investigations to rule out nutritional deficiencies or certain hormonal factors which can be key to the hair fall. Having done all this, and we have come to a diagnosis as to exactly what kind of hair fall this is and what are the different factors which are playing a role in the development and the perpetuation of this hair fall. Having done this, then we form an approach to treatment. Treatment is usually in the form of various kinds of services along with home care products. Services can be of various types. They can be both minimally to non-invasive and invasive. Home care is usually in the form of topical lotions or solutions to be applied on a day-to-day basis. A good hair care regime in the form of the correct shampoos and conditioners and serums, and also nutritional supplements which actually provide micronutrients to the hair follicle, along with certain drugs such as minoxidil and finasteride. Therapy to be effective, it must act on the roots of the hair follicles. There are many modalities available, various services that can be performed at regular intervals to stimulate hair growth. One of the simpler forms of therapy is infusion of micronutrients or certain cocktails containing vitamins and biologically active factors across the skin at the level of the hair follicles, with techniques such as iontophoresis, which works on the principle of electrical ions which cause the infusion across the skin, or mesotherapy, which consists of injections or micro-injections of these materials across the skin surface into the dermis. Both of these techniques serve to stimulate the hair fall and need to be repeated at regular intervals, which can be weekly or fortnightly, for about 8 to 10 sessions. PRP or platelet-rich plasma therapy is actually a newer therapy which is gaining a lot of popularity. We do this by taking a sample of your blood and separating out the plasma from the red blood cells. The upper plasma layer actually contains a whole lot of platelet-derived growth factors. And when we inject these back into the skin of the scalp, especially in the areas of hair loss, these growth factors stimulate hair growth. There are certain forms of low-level laser light which are also very effective in stimulating hair growth by stimulating the scalp blood flow in the areas. And this also, when repeated at least 2 to 3 times a week over a period of 2 to 3 months, usually is a good adjuvant to different forms of hair treatments for hair growth. Most of the treatments that I've mentioned earlier are excellent for mild to moderate hair loss. But if hair loss is severe, then one may need surgical modes of treatment, and that is in the form of a hair transplant.